Normally, only with head movement does fluid within the inner ear also move, informing the brain that a head turn occurred. However, should a crystal called an otolith gets displaced into the posterior canal of the inner ear, BPPV dizziness occurs. Fluid movement occurs due to the crystal rather than head turns, causing the brain to think movement has occurred even though none has happened. When the Semont maneuver is performed to treat posterior canal BPPV, the loose crystal is attempted to be removed out of the canal with a specific sequence of head movements. The Semont maneuver is not considered to be as effective as the traditional Epley maneuver, but for those who are not able to lay flat on the back due to pain, this maneuver can work quite well, which involves laying only on the body side. The Semont maneuver is first started by sitting on the edge of a firm bed, sofa, or table. Turn your head 45 degrees to the right if BPPV is affecting the left ear. Quickly lay down on your left side. Stay in this position for 1 minute. Torsional nystagmus will occur, which will subside usually within 1 minute. Then quickly go from laying on your left side over to your right side. Do not change the orientation of your head, so you should be looking diagonally downward when you are laying on your right side. Stay in this position for 1 minute. Slowly return to sitting position and sit on the edge of your bed with your head level for 10 minutes. At this point, the maneuver is completed. Keep in mind that with each position change, dizziness may recur and is perfectly normal. So what's going on with these position changes? Essentially, the head has moved in such a way to manipulate the crystal to fall towards the canal opening. With each position change, it can take about 60 seconds for the crystal to settle into the most dependent position in the canal. If turns are made before the crystal has a chance to settle, the crystal may fall back the wrong way, and the maneuver will fail. It is also important that the head positions are angled correctly, or else the crystal will not settle to the correct position in the canal, and the maneuver will fail. Also, if the position changes are done too slowly, the crystal may not settle quickly enough from lack of momentum, and the maneuver will also fail. Once the crystal falls out of the canal, the dizziness should resolve if due to posterior canal BPPV. If done correctly and successfully, doing this maneuver only once will cure BPPV, and repeated maneuvers will not be necessary.